My name is Kristy, and I'm a two-time cancer survivor. Today I'm here to talk about acute myeloid leukemia, or AML. I remember when I was diagnosed with AML. My hematologist called me on a Thursday night and told me that what I had was malignant but treatable. She asked me to meet her at the hospital the next day and to pack a bag because I would be staying.
The subjects we will cover today are: what is leukemia, how is it diagnosed, what are the treatment options, and how you can help. Leukemia can either be acute or chronic, and in the myeloid or lymphocystic cells. This gives us the four main types of leukemia. They are acute myeloid leukemia, chronic myeloid leukemia, acute lymphocystic leukemia, and chronic lymphocystic leukemia. Today, we are focusing on acute myeloid leukemia.
To understand leukemia, you must understand how blood cells are created. Within your bone, you have a soft, squishy material called bone marrow. The bone marrow creates a stem cell. They're cute. The stem cell creates a myelogenous cell. The myelogenous cell will then turn into either a white blood cell, a platelet, or a red blood cell. When the myelogenous cell does not create a white blood cell, a platelet, or a red blood cell, it creates a cancer cell. So, what are the symptoms of AML? Well, for me, it felt like I had a flu that wouldn't end. But the most common symptoms are nausea, fatigue, unusual bruising, and unusual bleeding. The first diagnostic test that you will do is a simple blood test. This will tell the doctor whether your white blood cells, platelets, and red blood cells are low. If that's the case, then they will do a procedure called a bone marrow biopsy and aspirate. What that is they will take a bit of the bone marrow out of your bone and take a piece of your bone and measure it scientifically. Based on what they discover from their scientific measurements, they will design a treatment plan. Usually the first round of chemotherapy, called consolidation, is with high-dose chemotherapy. And then you will receive 1 to 3 more chemotherapy rounds. Those are called consolidation. If all the conditions are favorable, it will be time for a bone marrow transplant. The day before the transplant, the patient will receive total body irradiation. A transplant is quick and relatively non-invasive. What can you do? The first and most important thing that you can do is donate blood. Cancer patients, all cancer patients, at some point will need a blood transfusion. Myself, I had well over 100 blood transfusions and many platelet transfusions. The next thing you could do is become a bone marrow donor. If you're interested in that, my last slide will have the website that you can go to get more information. And finally, you can donate money to the Leukemia and Lymphoma Society. They are working to find a cure, and they are supporting the patients that are currently going through this. Thank you.